January has been the deadliest month of the COVID-19 pandemic in the U.S. so far, and the month, it's not over yet. 83,000 people have died in January, and the CDC projects another 85,000 could die in the next 3 weeks. Dr. Nissola is a medical expert, immunotherapy scientist, and an advisor for COVID Act Now, a nonprofit that provides data on the pandemic in the U.S., and he's here to break things down for us. I always sort of struggle with immunotherapy, but Dr. Nissola, I'm glad you are here. These numbers are really disturbing. And yeah, you know, and it's funny because Vlad, we repeat these numbers and I feel like we say over and over again, oh, you know, these are record-breaking numbers. It's worse than it was before. And it's just, it's sadly repetitive. I want to play a little sound from the new head of the CDC yesterday talking about this pandemic and how they are responding to it.
Now is the time to remain vigilant. If we continue in the current trajectory, the CDC most recent national ensemble forecasts predicts that 479,000 to 514,000 COVID-19 deaths will be reported by February 20th, 2021.
So I guess the question is, what's driving these numbers? We all expected a spike post-holiday, but it feels like we should be sort of out of that time frame now. Is it the new variants? What's going on?
Yeah, again, thanks for having me. I wish I had better news to share. Unfortunately, what we saw yesterday from that press briefing is correct, is true. The case numbers are extraordinarily high. I think there is a wide array of variants that are variables that are driving those high numbers. And one of them, of course, are the new variants that are likely in community spread already in the United States. But also, you know, the response to COVID, it's not standard across states. And people are still crossing state lines and traveling and carrying them with them, the virus. So even though a state perhaps is doing their best to stay at home and to flatten the curve, some others are not. And until we have hotspots in the country and elsewhere, we're not gonna be able to control this pandemic. I think there is another layer there too, which is in regards to the four-tiered color-coded system that some states have in place that are very hard to understand and very hard to keep up. If you ask the average American which color your county is in today, is it purple, is it blue, is it green, is it yellow? We don't know because it changes because it's not standard. So I think we've spoken about this in the past, and I'm hoping to see some more standardized approach to this warning system as far as the case rates go, because we're still needing to flatten the curve, and we're already a year into this. So to me, it's pretty clear that folks at home are not understanding what governors are trying to do. And when you look at California, for example, 1 in every 6 Californians are illiterate. Are they understanding this puzzling, complex, four-tiered color-coded system of opening businesses and closing businesses? And again, are we still talking about reopening indoor businesses while we are seeing thousands and thousands of deaths a day? Is that even a conversation? So I think there's a lot of work to be done there.
So, Doctor, a team from the World Health Organization came out of quarantine in Wuhan, China today. And now they're starting to investigate the origins of the COVID-19 pandemic. So what exactly is this team looking for? And how would they identify how this virus came to be?
Yeah, I think the WHO team of experts, I think there are 13 experts there right now, trying to understand how this virus made the jump from animals, from the bat, very likely, to humans, and if there is any intermediate animal that it infected. So they're going to be collecting not only clinical data from the patients, but also samples from local animals, from the blood, from the stool, doing genomic testing, trying to understand how this virus came about, because it's quite striking that this virus made from the bat to the human without a potential intermediate animal. So I think right now, this first part of the mission, they're trying to establish communication between agencies that have been lost in the past year or so, and not trying to point blame, but actually trying to understand scientifically what happened there, if there is anything else to be learned. And I think there's a lot to be learned. And I think they're not going to leave any stone unturned.
They're not going to have a lot of time, though. I think they had a 1-month visa, is what we learned this morning, and clearly they spent 2 of those weeks in quarantine. But I want to ask you about something else that I had never heard of. So as people are getting these vaccines, we have heard that some people sort of get a sore arm as a side effect, and there has been talk about using over-the-counter pain relievers ahead of time to avoid that pain. I never heard that the pain was particularly significant, but maybe for some people it is. There's also the issue of whether or not if you take these pain relievers, it will lower your immune response to the vaccine. Have you heard that?
So there is a conversation between healthcare providers, scientists, researchers, to try to understand if taking over-the-counter painkillers, anti-inflammatories may stop your immune response or may affect negatively in your immune response. And the truth is, there isn't enough data to show us that there is anything there to stop your production of antibodies. But again, pre-medicating is not something that we recommend. I think we live in a nation that medicates at an extent that it's absurd. We need to acknowledge that. We also need to acknowledge the fact that not every single pain you have, you must take a pill for it. But again, if you are experiencing a side effect from the vaccine, you should talk to your doctor, and he should medicate you, or she should medicate you, or they should medicate you. But again, self-medicating is never a smart choice.
All right, Dr. Nissola, thank you, doctor, as always. We appreciate it.
Thanks for having me.